Good morning. My name is Simone Parker, and I'm with CalPERS Stakeholder Relations Team. We have about an hour today together, so let's make the best use of our time. With that, I'm pleased to introduce Yvonne Walker. She's serving her first term on our board. Yvonne has served California and our nation for more than 35 years, working as a union president, retirement security advocate, experienced pension fiduciary, state worker, and Marine Corps veteran. She is known for being one of California's foremost leader in fighting for pension and health benefits earned by our members and retirees. Please join me in welcoming Yvonne Walker.
Hi, good morning, everybody. It is good to be with you this Tuesday morning. This is our third webinar, and I'm very excited about it. They seem to be going really well, and I hope you think so too. I love all the reactions. That's new, so yay. I'm just going to dive right in. We've got an hour. I'll go through, and then I want to make sure that I leave time for any live questions that we have. So just as a recap, remember, I know you're all concerned about the health of the fund, right? So we have a return of 9.3%, ending our fiscal year of June 30th. And that's really good news because we exceeded our 6.8% target. And investment returns are really important because they pay for the majority of our benefits. And just to add just a little perspective, $30 billion were paid out last year in retiree benefits, and our fund is worth more than $500 billion. And I know this seems plentiful, but the board's role is to establish policies that make sure that the fund will keep growing, because our responsibility is not just to pay for benefits today, but it's to pay for benefits tomorrow and tomorrow's tomorrow, right? And so that's where a lot of our policies come for. And that signals the importance of long-term sustainability. They help ensure that the dollars we invest today will pay pensions like for years to come, like I said, including new commitments related to climate change. And I know that there's been a lot of discussion about climate change, should we or shouldn't we? But here's how I look at it, right? Nothing is infinite. So we have to make sure that as we're investing to look for changes, right? That are going to happen, that are coming. We do know climate change is real. And if our investment dollars aren't going in to reflect that, we could wind up with a problem down the road, and none of us want that. And so that's it. We are in open enrollment, and so it ends on October 11th. I hope that a lot of you have gone on, shopped the healthcare plans, made whatever changes that you wanted to make or needed to make, because remember this year, this will be our first year with Blue Shield and Included Health. If you were able to be on the board meeting, the healthcare committee meeting this last week, we actually had representatives from Blue Shield and Included Health. And so if you were not able to be on it, please, you can go and see that also on our CalPERS YouTube channel. But I was actually pretty impressed with them when they came out. And I will tell you, every time we talk about healthcare, it's hard, right? Because healthcare costs continue to rise. And so we're addressing it with the only tools that we have at CalPERS. As an example, 2025 is going to be another year of health premium increases. Medical inflation and high pharmaceutical costs are some of the reasons, right? But I will say that not all the news is challenging. Several other plans are expanding into regions of the state that lack affordable options. We've added some new services for members, such as support for traveling for medically necessary care that cannot be accessed locally. And I'm excited about that. And at this last board meeting, I heard for the first time about a program that we have. It's called, I just had it, I'll have to come back to that because the name just flew right out of my head. I think it's Access to Allies. But anyway, the gist of the program is it's designed to help us stay in our homes. Like as we grow older, and there need to be changes or modifications in our home, the whole program is designed to make sure that we can stay in our homes. And so this is just a teaser because I plan to have more full information on it for the next webinar so that we can talk about it. But I was very excited about finding out about it. I was told that the board approved it, I think 5 years ago. But I think that was really outstanding. And so with that, I am going to open it up for your questions. Oh, one other thing, there have been questions on the long-term care, right? And is it going? Yes. The board approved two 10% increases, one for next year and then the year after that. And what that is to help, to help keep ultimately to help keep the premiums down going into the future. And so with that, I will open it up. Please raise your hand. Let's have your questions. Let's have a good conversation. Hopefully I can answer a lot of them. And if not, we'll work through it.
All right, wonderful. Thank you. So I will call on you and I will have a team member unmute you and then you can address Ms. Walker. So it looks like Lewis, you're first on our list to ask a question. Go ahead.
Lois, you're still on mute.
Oh,
Yeah,
there you go.
I have to read the screen first. It's kind of an instruction that comes with a computer, right?
But
I
right.
thought I had sent this question in, but my concern is having left California to come back to North Carolina and help with my mom. I'm finding it a whole different world, to say the least. And I'm concerned about dental coverage. The dental coverage. Dental coverage.
Okay.
All right. At 80 years old, teeth are really important. And it's not very good coverage. It's better than nothing, and better than most plans have. But I'm wondering about how to get an increase in coverage. Can we purchase it, upgrade our current without losing something? In the past, I've asked this question many years ago, and they said, no, you have to give up everything or get a different plan. Can you help me with that quandary of how to improve my dental coverage?
So I will say that one, just for the record, CalPERS does not do dental coverage. That's through CalHR. And we do talk about that to see, what can be done, everything else, but we have no jurisdiction over dental coverage and anything else. The only thing I would recommend to you is if you're thinking about trying to see how you can improve your dental coverage, to talk to your an insurance agent or something to see if there's some plan out there that you can buy to supplement whatever it is that we have. But otherwise, that is not something that CalPERS does. And also, Lois, what part of North Carolina are you in?
Did you still unmute me?
Yes.
Yeah, you're unmuted.
Southport, North Carolina, right on the very tip end of all of that hurricane season.
Yeah, my
We're the
family's
ones
from
that
Rocky
just
Mount.
flooded. All of our bridges are gone and our roads are gone, except my little house is fine.
Well, I'm
My
glad
street
your
doesn't
house is
flood.
fine. I was just going to say, my family's from Rocky Mount, so that's I have North Carolina
Oh,
roots.
nice.
Right.
I like the mountains.
Yes.
Thank you.
All right. Thank you for your question. Next, we'll go to Margot.
Hi, I apologize. We had someone come and I think the woman who just can you hear me? I'm sorry.
Yeah, I can hear you, Margot. How are you this morning?
I'm fine, thank you. A little frazzled because just as you started, we're having some work done and some people came, so apologies.
Don't apologize. That's just the way it goes.
I may be asking the same or similar question, but we had to move to Arizona to help take care of my mom, so that's where we are. We're with, what is it called? Oh, sorry, I'm not prepared. A PPO Platinum, that's it, it's called Platinum. And I listened to the health Zoom, and it was never clear to me if I have a problem, who I talk to. Do I talk to CalPERS, or do I talk to this new organization that's taking over? We're with Anthem right now, and apparently it's
Right.
going to be Blue Cross.
And you
Yeah.
with Blue Shield, and that question actually came up during the board meeting, so I do have an answer. So
Yay.
you would start out with included health, right?
Okay.
And they would walk through and navigate, right, where you need, so you don't have to jump through a lot of hoops to figure it out, which seemed incredibly helpful.
Yeah. Okay, well, that's good. I was just so confused because sometimes it sounded like they said go straight to Blue Cross, sometimes to this new company, but go to the new company first, and then if I'm not happy, I would go. My second question is related to that. My husband is a longtime sufferer of pretty devastating migraines. They're I forget, they're called intractable migraines. And a few years ago, they came out with a new drug called Aimovig that has just been a miracle drug for him. But we have to get prior authorization. And I'm really worried that when we switch to this new place, they'll say, no, you can't have it because it is quite an expensive drug, but it's transformed his life. So do we know, will they be reasonable about prior authorizations?
Okay, I don't have an answer for that. So what I would say is, again, call included health
Okay.
and let them know, just like you told me, right? And they'll tell you, because I don't know if that's, where it is in the formulary and everything else. And I don't want to give you wrong information. What I will say though, in listening to the representative from Blue Shield, their primary mission is to provide access to quality health care, right? And so other
So
than
no-
that, though, I can't.
Okay.
Yeah,
Okay, thank you. I really appreciate it.
absolutely.
All right, looks like next on our list is Tina.
Hey, Tina, you're still muted. Okay, there we go.
Good morning. How are you?
I'm good. How are you doing?
Good, thank you. I wanted to respond to the first lady that said, was there any kind of supplement or anything she could get for her dental insurance? I had that same issue last year. I had a lot of dental work I needed done. And so I have Delta Dental of California, PPO. So I called them and they helped me obtain like a supplement policy that I
Okay.
could cancel at any time. I did have to pay a monthly, payment on that, but it did provide extra coverage for me when I needed it. So I don't know if you have Delta Dental or any PPO insurance, but they might have a supplemental policy that you can get. That's all.
Right. And I know CalHR just sent out the notice for, signing up. So you can sign up for, they do have the regular Delta Dental and the PPO. So thank you, Tina, for that
You're
information.
welcome. It's Tina.
Tina, oh, I'm sorry.
Yeah. Thank you.
Thank you for correcting me. I hate when people get my name wrong. So thank you for correcting me.
All right, next on the list is Karen.
Hey, Karen. You're still.
I don't know if you're talking about me. I didn't have
Yep.
a question.
Oh, okay, your hand was raised, so we'll just go ahead
Oh,
and skip
was
you
it?
if you don't
Oh,
have a
I'm
question.
sorry.
No problem. Looks like next on the list is David.
Hi, David. Okay, David is still muted. Okay, there.
There
Okay,
you are.
Yes.
okay. I got a letter from CalPERS saying that United Healthcare Medicare Advantage was raising its fee by more than 29% in 1 year. I think that's really outrageous. I don't know why CalPERS board would negotiate such a poor settlement with that big profitable company. They make billions of dollars in profit. And why would you allow them to raise that much in 1 year?
Okay, so first off, we don't allow them. I mean, we negotiate with them, and it doesn't always go the way that we want. But I also want to remind everybody, when you look at the premium increases, remember that it says 29%. I will use myself as an example, right? So because the state pays 100% for, I'm in the 190 formula, right? So even though United Healthcare, which is what I have, went up, I still pay nothing because of the share that the state pays.
Yes, I understand that, but that's way above the so-called inflation rate by the Federal Open Market Committee. It's way above that. It's greed. It's greedflation by a big corporation. And why would you not negotiate? You have buying power with all the members who are retirees, and it didn't seem like it was very successful bargaining at all. It's an outrageous increase.
Well, I will say that our team, that our healthcare team, I think they do an outstanding job, sometimes within very difficult circumstances. And there
Why-
are a lot of let me finish. There are a lot of factors that go into the rate increases. And so, and I get the disappointment from the rates being up that high. And the team continues to look for ways for the next time that we go into negotiations, but this is where we're at right now. But I do appreciate your comments, and I see what you're saying, and I'll take that back.
I think it's outrageous.
Thank you. All right, it looks like Luke, you're next on the list.
Hi, Luke. You're still on mute.
Luke, are you there?
I
Oh, there you
yeah,
are.
I'm here. Sorry about that. Little mess up there on my part. So thank you so much for doing this, Ms. Walker. This is really important to be able to speak with you. And I spoke with you when you got elected, before your election. You probably don't remember that, but I certainly do.
Remind me of the conversation. I will remember the conversation more than.
Well, it was about my question, which is about climate change. And so here's the question. In view of the fact that the state of California policy is to eliminate the use of fossil fuels, the California Attorney General has just filed a lawsuit against Exxon for lying about plastic recycling. Exxon sued its shareholders over shareholder proxy submissions, and CalPERS subsequently voted against all of its board members. And the bottom line being that fossil fuel stocks are a particularly bad investment. And for that reason, I have already divested them from my own personal portfolio. And it should be the fiduciary responsibility of PERS to do the same. Why does the PERS board vote? Why does the PERS board vote for a resolution to divest from fossil fuel companies?
Okay, so you guys are not asking easy questions today, but that's okay. So I will say that you're right. We do have a fiduciary duty. And it would be irresponsible of us, right, to say, okay, we're going to go out of this without having a plan forward to replace those funds. And so that's why we came up with our investment, I forget the exact amount, but our investment in alternate fuels, right? And alternate, I've got the wrong word in my head, so I apologize for that. But we're making sure that we're on a pathway. I mean, we can't just stop tomorrow, but we're on a pathway to limit our investments in the fossil fuels while we bring up other alternate ways, and making sure that at the same time we keep the fund strong. And I get that sometimes it doesn't go as fast as people want it to. To be honest, it doesn't always go as fast as I want it to, but we are on a pathway to get it done.
Okay, so there is a plan. Is there a name for the plan? Can we get a,
Yes, there is. And I will actually get it sent to you, but it's actually up on our website.
Okay.
But yeah, but if you don't find it, just send me an email and we'll get it sent to you.
All right. I'll do that because I'd like to see what the plan is. I mean,
Okay.
obviously you have to, uh, move the funds. It's going to take some time,
Right.
but we just want to make sure that there's a policy for this because
Yeah, we
it's
do
really
have a plan.
important.
I agree with you. And we
Okay.
do have a plan.
Okay. That's great. Thank you.
Okay.
All right, thank you for your question. Next, we'll go to Thomas Jones.
Hey, Thomas.
Calling on me. Can you hear me?
Yes, sir.
Okay. We have a United Healthcare Medicare Advantage PPO.
Uh-huh.
And September 1st, they now require prior authorization for physical and occupational therapy. It's been a month and I still don't have prior authorization. So that's frustrating. In the middle of the year, they changed the terms of service. And I'm just wondering, is there any way to find out? We haven't received any paperwork from them. What other surprises they will spring upon their insured, their patients in going forward?
Right. I have United Healthcare Medicare Advantage, and I didn't read it yet, but I just got an email that they, for their terms of service and everything else, they have a new one up on their website. You can look at that, but if you have specific problems with them, I encourage you to call our 800 number.
Okay, well, thank you. I have contacted United Healthcare Medicare Advantage United Healthcare personally, wrote a letter to the CEO and spoke with some assistant or something like that. And she said, well, that's just the way it is. We send out notices to everybody.
Yeah. Again, Thomas, I am going to ask you, and I appreciate that you did contact them directly, but I'm also going to ask you to, again, call into the call center so that we can, or at least email us so that we can get it on the record so that our team, when they're then addressing United Healthcare, they can say, like, these are the problems that we're seeing, that we're having, and, just to have a record is good.
Okay, so where's the contact information for you folks? Call center?
We're going to put it in the chat and we'll have it for you before we leave.
It'll be in the chat, you say?
Yes. Yes.
Okay, great.
They just put it in there. The 800 number is 888-225-7377. But it's in the chat and you can get it from there, and then that'll get us going. Thanks, Thomas.
Thank you very much.
All right, next we'll go to Ada.
Thank you.
Hey, Ada.
Hi, I have two issues that I'd like to bring up. The first one is long-term care, and I know that's an external contract that you have. For a couple years now, I've been filling out forms that said I wanted to go with the option of not staying in the program, but getting my funds out. And the court case is now settled as of the end of December. And I got a check for $1,000, which meant that long-term care people thought I was staying in the program. I immediately submitted a complaint or a grievance, whatever they call it, to challenge that. Since January, nothing has happened with my request to be opted out of the program. I've called every 3 months and they keep telling me, oh, we're now reviewing it. We'll get back to you soon, and they don't. I can't be the only person that this is happening to. I want my money out of that program, and in the meantime, they are continuing to deduct money from my retirement check for long-term care. And now I suppose I'll be getting the new charges for the 10% increase. When I asked them if I would get that money back from January onward, they couldn't guarantee that I would. The last communication I had said that they were going to put this in a court case. And that to me sounds like it's starting all over to handle me in a separate issue. I submitted my complaint form, and although at the time I couldn't find the most recent record I'd given them that said I wanted to opt out, A couple months later, I did find it and I sent them and they acknowledged the receipt of it. Every 3 months, I called them and no action. Should I be going to the legal services at PERS that I pay, I don't know, $9 or $10 a month for to get a PERS attorney to help me with this?
Okay, I don't give legal advice. So I don't know if that attorney would be able to help you, Ada, but what I did do is I have taken down your name. And I'm going to have somebody from PERS contact you with more direct information.
Thank you. I appreciate that. You know, I'm due $22,000 back and I'm had knee surgery and I feel like they're stalling me. If something happens to me, that money is gone.
Right.
And my daughter won't get it. So my other issue is similar to Luke's and to some other people about investments. In September, I read in the LA Times that PERS and STRS are investing in LLCs that are buying up apartments, condos, houses, and mobile home parks. I live in a mobile home park. Luckily, I have a good situation. It has not been bought up by an LLC. The LLCs get cheap loans, cheap interest rates from Fannie Mae and Freddie Mac. So they're using taxpayer money to buy these properties. And then they're going to PERS and STRS to have you invest in them. And they consequently skyrocket our rents and cause people to become homeless. So I want to encourage PERS to divest, not completely. I know you have to get a certain return each year, but this is a danger to residents all over the state when these greedy investors are coming in, raising our rents 50% in some cases. It's ridiculous. And we have no power other than banding together and complaining and educating. But I belong to a mobile home group that's grown from 0 to 2,000 members, and we are lobbying the legislators to pass rent caps for mobile homes. But this is a danger to us. And
Yes.
so I did write letters to PERS and STRS. I got a response from STRS. I haven't not yet received anything back from PERS. And if you want me to, I could send you the article from the LA Times. It does have it has other options that give a lower return, but are not as dangerous to renters. And that's included in the article. So if you put your website up there, I could send you that article.
Yeah, they'll put my email address there in the chat, and I'd appreciate you sending that to me.
Okay, thank you so much.
Thank you, Ada.
All right, so next up would be Jason Myers. Looks like, Jason, are you there?
Oh, there he is.
Okay. I think you just have to take yourself off mute now.
There we are. Can you hear me now?
Yes,
Thank
sir.
you. Hi, I am a retiree living outside of California. Most of us outside of California have only one PPO option for our healthcare, and its cost has gone up by double-digit rates for the past 2 years. We need more affordable healthcare options outside of California. When can we see some action on this?
I don't know. I do know that they work on it and they are working on it. To give you a timeline on, when there's a change or what, I can't do that, but I can assure you that they are working on it, making sure that, they have the best and lowest cost option that we can. I will tell you that this is just an aside. When I was representing actives, and we had, at Local 1000, we had folks that were in New York, Chicago, Texas, and Hawaii. And this is an issue that we have worked on also with no success. And so the the best success that we had was when we had the legislation from West Chesborough, who was from Del Norte County, right? But that sunsetted, and trying to get that, something like that, so it supplemented the premiums was hard after it sunsetted, but it is an issue that I know that the retiree organizations continue to work on, and also the active organizations, particularly Local 1000, continue to work on, because I will tell you just from my own personal thing that it baffles me, and I really don't understand it. I wish I did, and nobody's been able to explain it. But you know, we have the same healthcare companies across the country, and why that we can't, you know, figure out how to you know, so that when we have people that are you know, just in different states or whatever, like how we can't access or have some reciprocal agreements. So I don't know, but I can tell you we are working on it.
Thank you.
Jason, you went on mute again. Sorry.
There you go. You're off now.
Thank you. I have been on several meetings now when I have raised this issue and others have raised this issue. So I hope that it is getting near the top of CalPERS agenda.
Oh, it is. And I will encourage you to continue raising the issue, but it is not a simple answer. I've worked on it for years, and it is not a simple answer, but I also don't want you to go away and think that we're not paying attention. And we're not trying to find something. We just haven't found the solution, and we'll continue to plug away until we do.
Thank you, Jason. Next is up is Pamela. You should, there we go.
Hi, Pamela.
Hi, good morning. I'm caught up in this replacement benefit fund snafu, which is basically a penalty that they apply to individuals that make whatever the IRS determines is the threshold. And in this case, it's quite low. It takes a third of my income and it puts it into a separate third-party administrator fund where I get that part of my retirement check. Sometimes I don't get it until 2 or 3 months after the first of the year, because I only get it as the entities that paid into my retirement pay into that fund. I also am charged an administrative fee to this third party for having to facilitate that RFB check. I think this is kind of a violation of my right as a retiree and the money that I paid into it. I was never asked. It was just something that was implemented. And how do I go about getting this whole thing revisited, or at least taking a look at the thresholds, because they're way too low?
Pamela, I don't know. This is the first time I'm hearing of this issue. I'd ask you to send me an email,
okay,
so that I can get it to folks that can provide you an answer, or
okay.
at least, you know, have more knowledge of it than I do.
And what email would I send it to?
It's Yvonne, YVONNE .Walker, WALKER, at calpers.ca.gov. And they'll put that in the chat also if I went too fast.
Oh, perfect. Okay, I will do that. I'm starting to do a letter writing campaign and I don't really know where to start because it just intertwines in so many areas. And today was interesting to me because at least I'll get a start on where to begin.
Yes, yeah. Okay. And that would just be helpful, because then I don't like to give out erroneous information. So
okay, thank you so much.
Okay.
Thank you. Next up is Thomas.
Hello.
Hey, Thomas, how are you?
Good morning, ladies, or in my case, I should say good afternoon, since I'm in North Carolina as well. Not far from Rocky Mount, actually.
Oh, cool.
Yeah. I'm turning 65. I'm obviously living out of state. I retired about 8 years ago from the Golden Gate Bridge, and we have a bit of a different plan, so that kind of throws a curveball. I've received my Medicare cards, and I'm with Anthem PERS Platinum right now. I'm just wondering, what do I need to do next?
Oh, good thing we're in open enrollment, right? And so you should have gotten a letter from CalPERS telling you what you need to do. But if you didn't, call into call the 800 number that we've put in the chat, and let them know. Having just gone through that, I turned 65 in July, so welcome to the club. You actually do relatively little, right? Because because you're already enrolled, they share things with CMS, so that that they know. But I would just call into the 800 number just to check to make sure that everything is in line.
Okay.
And did you register? Did you go on the website for Medicare?
Yes, I've got my card already.
Right, but go on the website, because that also was helpful to tell you that, like, this is what you have, you're covered, and this is what we show for you. It's actually pretty seamless, though it seemed, at first it seemed very intimidating, but once getting into it, it was seamless. And so
Okay, good.
it should be all right. And you do know that come January, so if you've got Anthem, it'll
Right.
switch over to Blue Shield. Right?
Okay, and what, do I need to do anything there?
Well, no, you don't, because you're not going to change your plan, because all you have is the platinum. So it will move you over automatically to Blue Shield. But you should still go on and just check and make sure that you're seeing all the differences there.
Okay.
Okay.
And I need to fax PERS my Medicare card, correct?
No, you shouldn't, because they should already know, because I didn't. But
Okay,
again, call the 800 number. You should not have to, but just to make sure, because you don't want to,
right. Don't want any lapses. Yeah.
Absolutely. That was my concern, because I was going, anyway, you don't need to know my personal story, but that was my concern. And so I was very conscientious about it.
Well, thank you very much, ladies. I really appreciate it. You have a good day.
Yes. Thank you.
You too, thank you. Okay, next up is Susan. I think it's Kruger. I apologize if I mispronounce your last name.
Hi,
Yes,
Susan.
that's my last name. Thank you. I think, good morning.
Good morning.
I think, Yvonne, you and Thomas just answered my question. I just turned 65 in June, and I already had 100% coverage through CalPERS. So they sent me a letter and they enrolled me in Medicare Advantage.
Right.
So I have that now, and I think I'm set, but some of the my colleagues who are just now retiring are concerned about whether they have to change plans or what they need to do. And I just thought it was seamless, but it sounds like what happened with me is what you're describing.
Right. It is, and I will tell you, I was worried myself initially, but it did turn out to be seamless, right? Because I was in United Healthcare, and they switched me over to United Healthcare Advantage. And the only reason it would change is if I said, "Oh no, I don't want to be with United Healthcare Advantage now. I want to go to Kaiser." That would be the only reason it would change. But I did not want to change anything, and so they just moved me over. It was very seamless, yeah.
Well, that's good. I that way I can tell my colleague, because she's about ready to retire, that if she wants to keep her current PPO, it probably should just move into an Advantage for that. And if she wants to change the PPO, then she can. Is that right?
Right. And especially now that we're in open enrollment. So she should go out there and see, what her options are.
Okay,
I
great.
didn't want to, because, my doctors were all, in the same place. I needed to keep my same doctors. And so,
Oh, of course. And I like the ones that I have too. Well, I just thought
Right.
I was missing something here. So thank you for explaining that to me.
Sure.
Appreciate it.
Okay.
Have a good
And
day.
one other note, I will say that, at first I was panicked because I thought we were going to get our Medicare card automatically. And I didn't get one, and I was trying to call and everything else. Turns out they do send it automatically, only it didn't come in an envelope that said, "This is your Medicare card." And it probably went in the shredder because it didn't have any identifying information on it. But I called and they sent me another one, and everything was fine. So
yeah, everything worked out. And in fact, it's all worked out with Delta Dental as well. I know another woman was asking a question about that. And
Right.
they're covering that for me too. So,
Yeah.
okay, well, thank you very much.
Absolutely.
Thank you, Susan. Next up is Arthur.
Hey, Arthur. You're still on mute, brother.
My question is about United Healthcare Medicare Advantage Edge plan. And can you help me understand why we dropped that from the, and as a opportunity to sign up for? And because we left Kaiser after 25 years, we're disappointed with the Kaiser Medicare plan, and then we love that plan, and all of a sudden it's going away.
Yeah, United Healthcare dropped that plan. They were no longer offering it.
So it wasn't an option for CalPERS to keep.
No.
Okay, thank you.
Okay.
Thank you. Let's see, Paul, you're next.
Hi, Paul.
Am I here? Can you hear me?
Yes, sir. You're here.
Hey, good morning or afternoon, wherever it is. I am a retired annuitant, and so is my wife. I'm going to do two things right here because I, as a retired annuitant, am now not only substituting the school districts, but I'm also in the Medicare business. So some of the people that have been all these questions, one of the things they need to remember, there's so many changes in the Medicare industry this year. And I mean major changes, more than there's ever been in the last 10 years.
Right.
None of the official information, I heard some of them say they're kind of trying to get a hold of somebody and get some information. Legally by CMS, none of this information can be released till after October the 1st, no matter what.
Right.
So, I mean, even me, I don't even, as somebody in that business, I don't even have all of it. They are very late on bringing it because of the major changes, especially with drugs and everything else. So if some of your people want to know, I encourage them to get a hold of somebody that's a Medicare specific in that industry, because it's really affecting that more than it's affecting the normal insurance industry itself.
Right.
Okay, so I'll get that out of the way. Now, my issue is my wife and I have always, over the last, since we've retired, have always substituted into school districts. We know we've always done the 960 hours per year. We go by it daily, we'll look in, and if somebody's sick and we like what it is, we will go on the substitute finder and we'll go ahead and work that job. Well, unbeknownst to us this year, we've had a couple of school districts that said you can no longer work for us. And this is basically, and I have gone back and forth with them. I have talked to CalPERS. I spent 40 minutes one day speaking with a representative on there, and I'm getting so much conflicted information, it's absolutely ridiculous. But here's one of the school districts. As a CalPERS retiree, you are no longer permitted to fill in for permanent staff positions, vacancies. Doing so would violate CalPERS new retirement restrictions, which now only allow retirees to work as an extra duty capacity. If you accept an assignment that involves filling a vacant or open position, you would be in violation of these new restrictions. This would result in mandatory reinstatement from retirement into your position of your filing. Consequently, your retirement allowance, pension payments would be stopped, and you would be required to reimburse CalPERS for the retirement allowance received during the period of employment. Additionally, you would need to pay your employer the member contributions plus interest, to avoid jeopardizing your pension payments. Please limit your work to extra duty assignments. The funny thing is, no school district has extra duty assignments because they all work off the system of the substitute system that they have, the call-in. So this is what's coming through. Now, with my investigation on what I've done, not only with the school districts, I found that CalPERS switched up some of this restrictions to avoid double dipping, which I'm all for. And believe me, I know people in the past that have done that. So I well understand that. But I think if they did that, that's okay. But I think they just didn't go into definition or clarification, because now it's affecting people like myself and my wife and other people that we know. We can no longer supplement our income by working in the school district now. And the funny part about it here in California is you can pick up into that substitute thing any day of the week, and there's hundreds of jobs available that they can't even fill. And now they've just eliminated a whole bunch of us that can no longer work. So what is the CalPERS thing here? of, are we gonna be able to work? Are we not going to be able to work? Have you just wiped us off the slate here?
Okay, no, well, let me just say CalPERS did not wipe you off the system, but let me get you a much better answer than I can give you off the top of my head.
Okay.
It's been a while since we've discussed it. And, what we did do was, like you said, making sure that people weren't double dipping. Part of it, I know, was problems with the school district not reporting accurately, and then it became problems, right, for accounts receivable and everything else. But let me get you a much better answer
Sure.
than what I'm able to give you off the top of my head and get that sent out to you.
Oh, that'd be great. Yeah,
Okay.
because I'd like to clarify it, and because apparently the school districts don't want to take that next step to fix and clarify whatever the problem is.
Absolutely. And they
I'd be
don't
more
want
than happy to help
accountability.
them do that.
Absolutely.
Okay, well, I appreciate that information, and so it still basically goes back to the 960 hours per year, and nothing's changed in that, or has it?
There were some changes, and again, I don't know them off the top of my head. I wish I did. But what I would, like I said, I'll get you a much better and detailed answer, and hopefully answer, the questions that you have.
Yeah, and I'd appreciate that, because I think if you go back into the reading of it, I think the mistake was there's just not a clarification addressing that issue. So it leaves it wide open, and that's what the districts are doing.
And that's what they're seizing on. Okay, that makes sense. Let me get you a better answer, though.
Okay, I appreciate that. Thank you very
Thanks,
much.
Paul. No problem.
Thank you, Paul. Next up
Thank
is
you.
Deborah.
Hey, Deborah.
Hello, everybody. Can you hear me?
Yes, ma'am.
I want to say thank you for giving me the opportunity to ask my question. I'm now 65 and on Medicare.
Uh-huh.
And I live here in California, but I also reside in Morocco, Africa.
Oh.
Yeah, and it's been a challenge with the medical. Every time I have a medical condition, I have to come back to California. The last time I came back was for shoulder surgery on my shoulder, and I'm getting ready to return. My question is this. I know that I cannot use Medicare outside the US. And this has been my confusing part. I want to go back on, this is open season now. I want to go back, I want to get on PPO, which is platinum. When I leave California, do I need to call CalPERS office and say, hey, I'm returning back to Morocco, Africa. Medicare can't be used there. Can I just stay on platinum only? How does that work? It's been very confusing for me, because when I call them, they don't really know, or they don't seem to know. I'm just trying to get an answer. What to do?
Wow. Okay, I will just say, Deborah, this a very unique question.
Hey.
I don't know. Not a surprise that I don't know, because it's a unique question. So again, you're going to be one of the ones that we're just going to have to get back to, right?
Okay.
Because I don't have the ability to give you any advice, and I don't know what to do. And I know it makes a difference on which plane you're on and how that works, but I don't know that,
Yeah.
I just know that in general, but not off the top of my head.
Yeah, I think I would have to pay, some of the premium. I don't know, I'm supposed to be 100% vested, but I
Right.
just need to know, am I gonna be enrolling in the platinum basic? Because Medicare cannot be used, and it's my understanding, I pay out of pocket over there. I have before. And I bill them, the bill, my medical bill.
Right.
Bill them the medical bill. So I know Delta Dental works that way, because I've used them over there.
Okay. All right.
But the medical part with this Medi-Cal thing now has become complicated for me.
Right. Yeah, and you'll probably have to be in have a supplement, and not, but I don't know, and I don't even want to start going down that rabbit hole.
Okay.
So this is interesting to me. I've taken your name down.
Okay, thank you. And if you just like I've been getting your emails, Yvonne, when you send out, update, I do get them. But if you can just remember that for me, and when you send it out, I'll catch it. I read my emails all the time.
Okay, I'm
Yeah,
making a note right now, so
yeah,
hold on. That's when you see me looking down, I'm
that's
making a note,
okay.
otherwise, my memory is not what it was, so.
So I understand that. It's just very important because,
Oh,
like I said,
absolutely.
I've had two medical situations. I had an ulcer they found over there, but I had to come back here to Kaiser to make sure that the medicine they gave me, because it's all in French, that it really healed me, and it did. And then surgery, I had to come back here because, of course, they told me don't get cut on there, staph infection. You want to go to Europe or come back to America, which I did.
Right,
So I
right.
just want to know, because I can't use Medicare, so I need to know how to move. Should I just stay where I
How
am?
to
and-
navigate your healthcare,
There
right,
you go. There you go.
right.
So I would appreciate that.
Yeah, and it'll be quick, especially because we're in open enrollment, so you want to make sure that you're picking the right one.
Exactly, and I'm doing that research now, so
Okay, all
if
right.
I can get some help with that understanding, that would be great.
Thanks,
Again,
Deborah.
thank you for the opportunity, allowing me to ask my question. I love your town hall meetings. They're very informative. And I just want to say thank you for that. I appreciate that. And you guys have a wonderful day.
You also.
Thank you.
Thank you. Next up, we have Susan Carlins.
Hi, Yvonne.
Hey,
First,
Susan. Oh, and then she went away. Oh, wait, there she is. You're on mute, Susan.
am I now okay?
Now you're okay. I was like, wait a
Okay.
minute.
I'll stay a mile away from the screen. First, thanks for your service as our retiree rep. As a volunteer, I appreciate what you do.
Yeah, and I appreciate you guys having faith in me. So it goes both ways.
Good. My husband and I are both retirees from CalPERS. We appreciate what Luke said. So we're glad there's a plan to eliminate fossil fuel investments. So we realize, because we haven't bothered to do that. We should, but we haven't done it. But we're glad you're going to do it, and we will too. But in the meantime, I'm just concerned because over the 10 years since I've been retired, CalPERS rate of return has been significantly less than ours. I know you have other things to consider than we do, right? We're just a couple with kids, but we use no-brainer Vanguard mutual funds with very low costs, and we don't pay anybody to help us, and we've still done better. I've read some criticisms, in the press about not about you, but about some of management and some people who probably aren't there anymore, who got goodies from hedge funds or whatever. So it looks like you're working to improve. I just would like some comment from you on this because it's really important to me. I think about it a lot.
Thank you. And I'm glad you brought this up because I forgot to talk about this in my opening statement. So we hired a new chief investment officer, Stephen
Gilmore.
Stephen Gilmore. Yes. Yes. He came out of the super fund in New Zealand. I actually had an opportunity once he was hired to sit down. We talked for about an hour and a half, right? And I feel confident that with the direction that Stephen is taking us in, that we are going to exceed, right, where we're at. He had some of the same observations, and this is something that the board has discussed and given our opinions on, and so I'm looking for good things in the future. Some things I can't talk about right now because we were in closed session, but I'm looking for good things for our investment in the future. And I think that I wasn't there. I was out on medical leave when we went through the hiring of Stephen, but I think that my colleagues did an outstanding job in selecting him. And I think he's going to be a game changer for us.
Okay, well, I appreciate hearing that. And, just to say, like, CalPERS is proud that you've improved to 9.3% in the current year. So I just look back on my 401k with Fidelity that I have in 3 different funds, and it was like 16.6. So I'm like, okay, I just hope that you guys are keeping your costs low and there's no more, when you work in the county, nobody can hardly give you a box of See's candy because that
Right.
is like,
Right.
so the
Right.
fact that, I just hope that nobody in your investment group is getting any goodies
No,
from.
they're not. They're not. And let me just say, in fairness to our investment group, we have some outstanding people that work on our investment team, right? And I will say that part of the challenge has been for CalPERS is the amount of CEOs that we've gone through over the years, because then it's hard to sustain a program, right?
Right.
But I am confident that Stephen's going to be here to see us through, and he is the best one to take us forward as it relates to investments.
Okay, well, I'll be keeping an eye, and thank you for you doing the same, Yvonne, because we're all counting on you. We need this money to live in retirement. You know what I mean?
You and me both. Well, I mean,
I don't
from a
have
self-interested position.
my healthcare isn't through CalPERS, but I sat through all these questions because this is really important to me, and I think if other people knew, it'd be important to them too. Thank you.
Absolutely, absolutely. Thank you.
All right, Yvonne, we're at 10:56. Would you like to take one more question? Or would
Yeah,
you
we'll take
like?
one more question and then we'll wrap it up.
Okay, wonderful. So it looks like next on the list is Bruce.
Hey, Bruce.
Hi. So can you hear me?
Yes, sir.
Okay. So I was with CalPERS for 26 and a half years, and I retired in 2016. All of my medical benefits were through my union with Riverside Sheriff's Association.
Okay.
Now I am retired and have been for 8 years. All of my medical benefits have to be through RSA, Riverside Sheriff's Association. How do I get medical coverage through CalPERS? Is there a way to make that happen?
I don't think there is. I don't think there is. It's based on your contract and the funds. And I don't think that you come through the CalPERS medical.
Yeah, the way I understood it was if I had 1 month of coverage while I was an active member, then I could have got medical benefits through CalPERS. But because I didn't have a single day of medical through during my active time with CalPERS, I'm not eligible. Can that be looked at or changed?
I don't know. I don't know if it can be changed, but I will certainly look into it.
It would be beneficial because I live in California and I'm planning on going out of state, as a lot of our members are. And so I would want to go on the platinum plan, which I think CalPERS plan is better than what my association, because mere size and membership, is a better plan.
Right. Yeah. And then I will say that for a lot of the police officer associations and things like that, it went according to their contract negotiations. But I will certainly look into it. I don't have an answer, but I will look into it. Don't know if it can be changed, but at least you'll know, right?
Yes, ma'am. I appreciate that. And would I expect an email, or how would I get correspondence?
It would be an email.
Perfect. Thank you so much. I appreciate you guys' time.
Right. And Bruce, let me be clear. It probably won't be an email from me, because again, I wouldn't have the correct answers for you in case you had additional questions. But it will be from somebody who's familiar with the issue.
I appreciate that. Yeah, just get me to the person that has the know and get me in touch. I would appreciate it.
Absolutely. Absolutely. So guys, I'm going to wrap it up here. I appreciate all of you for getting on. Just as a reminder, we'll do this in a month and a half. Every other month, not a month and a half. Every other month I do this. So the next time will be, we're in November. The next time will be in November. And I look forward to it. These have been great. Any suggestions you have, again, email them to me, and I'll try to incorporate them in. Thank you so much, and I'll see you in November.